Once again, thanks to the team for giving me this opportunity. So this talk is about type 1 diabetic kid, managing them during the sick days. So a child who has been diagnosed with type 1 diabetes, initiated on insulin, will land up in the ICU again with DK only for two reasons. Either they have stopped insulin because of some misjudgment, or the child had gone for some illness, and during the illness the management of diabetes has been gone haywire. So sick days are actually a storm for any type 1 diabetic kid. So we know that insulin is a hero hormone where it fights against the other four important hormones which increases the blood sugar, and we can expect that during the times of stress the counter-regulatory hormones will be high and the requirement of insulin may be high also. So what is special about type 1 diabetes is we all know that because of impaired leukocyte function, in cases of children, especially with impaired metabolic control, there is a altered immune function and there is increased susceptibility to infections as well as delayed recovery. So these children are specifically prone for urinary tract infections, and URI and all, there is no much difference. So these children should be protected by all the vaccines appropriate for the age, and we should be in the lookout for infection. We have to prevent infections as well as we have to treat them very early. An usual phenomenon will be hyperglycemia, because we know there is an increase in the counter-regulatory hormones. But remember, children are prone to develop diarrheal illnesses, and when there is a diarrheal illness, when there is a GIT issue, these children are prone to develop very severe hypoglycemia. So it is not hyperglycemia always. That is something we need to remember. The most important lesson or the most important message which we should drive into the parents' brains is we should never stop insulin. For a type 1 diabetic kid, insulin is just air. So the child will die if we stop insulin. And sometimes what happens is during the illness, the child may not be taking any food. So the parents, because of the fear for hypoglycemia, they may just skip insulin. And the child will definitely land up with diabetic ketoacidosis. So we should tell them, when a child is vomiting during an illness, it could even be because of ketosis. So vomiting doesn't tells you that you should stop insulin. If you give insulin, the vomiting may subside. So we have to give insulin. It is not that you have to stop insulin. And insulin requirements, as we have already discussed, may be high during the times of stress. But remember, there are conditions where insulin requirement can be low also. So we should be doing proper monitoring. So we need to check the blood glucose every 2 to 3 hours, because we know that in type 1 kids we always check the blood glucose. Some children or some parents do it 7 times a day. Some may be doing it 1 or 2 days in a week. There may be some kids who are doing it once in 10 days or something like that, which is suboptimal. But remember, when it is a sick day, it is mandatory that there should be at least 7 glucose records, and in between also it may be needed. And we have to test the urine or blood ketones every 2 to 3 hours regardless of the blood glucose level, because ketonemia can occur even with hypoglycemia or hyperglycemia, which can cause multiple symptoms and which can hinder the nutrition also, as well as which can produce dehydration. So which is better? It is always the blood ketones are better. If the child or the parents can afford a blood ketone meter, it is the best because it measures the BO/BH, but we know that urine, it is only the acetoacetate is measured, which is actually developing early. The urine ketones will be appearing late, so we may miss a ketosis, but always blood ketones are better. And we need to document the symptoms, we need to document the blood glucose ketone levels, insulin doses, as well as the fluid intake, and the child should be in constant contact with the managing diabetes team. If they can afford a continuous glucose monitoring, it will be very useful when we are doing a sick day management, because there will be a lot of highs and lows, and we can titrate the dose of insulin, we can titrate the fluids, the intake, everything by looking at the continuous glucose monitoring graphs. We need to encourage frequent intake of fluids to prevent dehydration and help flush out ketones. And when we are explaining this to parents, beware, the fluid for them may be Coca-Cola or fruity, so we should always tell them which fluid to use. So these are actually dehydrating fluids which we should avoid. So sometimes we may have to give sugar containing fluids like kanji water or some the carbohydrate along with water, and sometimes we need to keep the sugars low, also looking at the level of the blood sugar. So we need to maintain the carbohydrate intake and always use easily digestible foods, and if unable to eat solid foods, liquid foods with carbohydrate is also enough. And if able to drink, always give oral fluids. If the child is having a blood glucose level below 250, the fluids can contain carbohydrate. If it is above 250, better to have carbohydrate free fluids. And whenever you think that the child is unable to drink, always go for IV fluids and don't wait till the child goes in for dehydration. Then additional rapid acting insulins may be required for hyperglycemia. Insulin dose adjustment should be made on the blood glucose and ketone results. So there are some sliding scales which are available, and this is one important thing we all should know, that when we use a urine strip, the dark brown color tells you that it is large ketones, and that is the time the child should go to the emergency. And regarding the blood ketone values, any value of more than 1.5 millimoles per liter, the child needs to go to the emergency, because there is a high chance the child goes for a diabetic ketoacidosis. And always tell the parents that this urine ketone strips has a very small expiry date, and also it should be checked in the freshly void urine, and it should be read immediately, maybe after 30 to 45 seconds. So these were the sliding scales which I was telling you. So this is a very busy slide, like I have simplified it for you. Like you can just look at the blood sugars and also the ketones, and then decide on how much insulin to give. TDD, we all know that it is the total daily dose. So according to the blood sugar levels, if it is very high, that is more than 400, we may even give 20% of the total daily dose as an extra dose, or say complementary dose in whenever the child is having ketosis. And whenever it is urine ketones are high, we need to give high doses of extra insulin. And when we are having no ketones and the blood ketones are less, we can give extra insulin to the percentage of 5 to 10%. And like that, when you are having hypoglycemia, along with ketones are positive, that is the time you need to decrease the dose of insulin. We may have to decrease the dose of insulin by 20 to 50% in some cases, especially when the child is having a diarrhea with vomiting. So sometimes we may be giving the dose, even half of the dose may be enough for the child. But all these adjustments should be done only with the proper monitoring, proper and frequent monitoring of blood sugars as well as the ketones. I have told you the blood ketones are more preferable. So this is something we all know, that this is how the 24-hour blood sugars is to be maintained. So even in a sick day, always try to maintain the blood sugars between 70 to 180. Any value less than 70 or more than 180 is unacceptable, and tweak your insulin doses as well as the fluids as well as the carbohydrates to maintain the blood sugars between this particular target level. And when to seek urgent specialist medical review, or when should the child go directly to an emergency room? Whenever the blood glucose is rising, even after your adjustment of the insulin doses, when there is an acidotic breathing, or the blood ketones are more than 1.5, or the urine ketones show that it is large, that is brown in color, then you have to go to the hospital. And whenever a child is very tired, confused or hyperventilating, and abdominal pain, always remember, severe abdominal pain is a very common symptom in a child with DK. And change in neurological status could be the sign and symptom of a cerebral edema or cerebral injury. So such a child also should go to the emergency as early as possible, because we all know that cerebral edema, once established, has a very high mortality rate in DKA. It is more than 25% even in the best centers. So this is a summary of what to do. The insulin should never stop. That is a very important message. Very clearly we should tell, and adjustments are needed. Monitoring should be there, especially of the glucose and ketones, which should happen very frequently. Maintain the hydration, maintain the nutrition. The child should not be starving, and also we should not use high sugar containing fluids to maintain the carbohydrate levels. And the record keeping is very important, and whenever there is a problem, contact the medical team for help. And this is actually from the ISPAD guideline 2022, which has come for management of the sick children. This will be very useful for all of us in practice. This is what I have elaborated during these few minutes. And thank you. I will take questions.